Okay, we are ready to go.
Brilliant.
To my right is Emily Dye. She is the Policy Director for the Australian Taxpayers Alliance and for Legalise Vaping Australia. To everyone who's joined into our Zoom breakout session to discuss vaping, thank you so much. Emily, I'll throw to you to make an introduction to the different speakers, and then we'll just expound on what this discussion is going to be around before going across.
Absolutely. Well, to start, I'll introduce Brian Marlow. He is the Executive Director and Campaign Manager for Legalise Vaping, and he has been doing this for a little over a year, 2 years? 2.5 years. We recently had a big win at delaying the import ban on nicotine vape liquids in Australia, and Brian Marlow has a lot to do with that. We have Michelle Minton, and Michelle Minton is a senior fellow at the Competitive Enterprise Institute, where she specializes in consumer policy, including reduction of harm from tobacco and legalization of cannabis. She authored many studies on the history of gambling regulation and the effectiveness and unintended consequences of sin taxes. She argues that rules and regulations designed to protect adults not only infringe on personal liberty, but are also counterproductive and cause more harm than good. Next up, we have Guy Bentley. Guy Bentley is at the Reason Foundation, and he's the Director of Consumer Freedom. In his research, he focuses on sin taxes, his primary focus being taxes and regulations imposed on nicotine, tobacco, and alcohol. Prior to joining the Reason Foundation, he worked as a reporter in London and in Washington, D.C. We have Greg Connolly. Greg Connolly is the president of the nonprofit American Vaping Association. He champions tobacco harm reduction through the legalization of vaping. He is also an attorney where he actively fights anti-tobacco reduction legislation. His writing has appeared in several countries, and he has attended dozens of conferences, conventions, and state legislatures. And lastly, we have Paul Blair. Paul Blair is the Director of Strategic Initiatives for Americans for Tax Reform. He handles federal, state, and local issues and projects. As part of his role, he campaigns for the legalization of vaping and tobacco harm reduction. In addition, he advocates for criminal justice reform and free market energy reform.
Some pretty well-versed people in the world of the vaping policy space. So we're going to throw across to our speakers. Thank you so much for joining. It's an international conference, and we really appreciate you making the time. Australia, by comparison to the rest of the vaping world, can seem quite small, but it is a very vocal community here, and we really appreciate you jumping in to help us with this campaign and help with your support. So thank you.
And we'll give the floor to, who's starting with
Michelle Minton.
I think we want to start with Guy, actually, right?
Oh, Guy, sorry.
There we go. So, Guy, I'm just going to start with you.
Awesome. All right. Well, thanks everyone for tuning in. Thanks so much, guys, for having me. I want to take us a little bit back to say where we are in the vaping and e-cigarette and harm reduction debate at the present time. If we think back to the origins of vaping and the modern day e-cigarettes invented by the Chinese pharmacist Hon Lik back in the early 2000s. And we actually see from them stemming a lot of success. We see a booming industry driven by consumers and people sharing information, thousands of small businesses set up across the world. I think across the world now there's around 40 million vapers. So there's a great success story there. And it's a great story of innovation, which is well documented in Matt Ridley's new book called on innovation, and documenting how just by combining a bit of electronics and a bit of chemistry, Hon Lik was able to create this great harm reduction technology, which really looked like it might displace and maybe will displace cigarettes as the primary form of nicotine consumption at dramatically lower risk in the world. But unfortunately, as the years have gone on, the understanding of e-cigarettes and their risks to the public and to public health have actually gone backwards, unfortunately. And a lot of my remarks are going to be focused on what's been happening in the US in the last couple of years, but also with reference to Australia and other countries as well, because unfortunately, much of the rest of the world does follow very closely the advice and guidance of the American main public health agencies, so the Food and Drug Administration and the Centers for Disease Control and Prevention, the CDC, which is often labeled as the world's premier public health organization. Now, last year, I would say in this sort of long debate over vaping and vaping policy was probably one of the absolute worst. You had a twin situation of a rise in the number of youth in the United States who were experimenting with vaping. And you also had an outbreak late in the summer of what was later called EVALI, or e-cigarette and vaping associated lung illnesses. And those two things combined together to shape a public narrative that e-cigarettes were in fact more of a threat than a harm reduction technology. But the problem was in that when these cases of vaping related illnesses first started cropping up in the US, even I, for a split second, had a bit of a doubt of a position I'd held for a long time, which is that vaping is a fantastic alternative to cigarettes, and it's going to get millions of people off smoking. We're going to save millions of lives. And for a split second, I thought, wow, I saw these cases coming out of people getting lung injuries and even some deaths, and saying, oh, was I possibly wrong? But then I quickly snapped out of that split second and thought logically and said, well, these products have been around for almost 10 years now. Millions of consumers across the world, in Europe, in Australia, in the United States, and in Canada, and we hadn't seen this before. And very quickly, when the characteristics of the patients being admitted to hospital were known and released to the public, we saw a very clear pattern emerge in which the overwhelming characteristics were people that were young, and the products they were using were overwhelmingly THC-related products, mostly that have been bought on the black market. And people were raising the alarm about this very early on, saying that this clearly has nothing to do with the nicotine e-cigarette market. This is something new that's been introduced into the illicit cannabis market. Publications such as Leafly, which is a website that very much reports on cannabis and marijuana issues in the United States, both Michelle and everyone else on this call were writing about this very early on. But the knee-jerk reaction to the media hysteria that built up over these cases of lung illnesses, everything was just considered vaping. And there was no nuance in the discourse about whether these are nicotine products or marijuana products bought on the black market. So there was a huge reaction from governors across the country to ban flavored vaping products, which had been blamed for the rise in youth vaping. So you saw the anti-vaping narrative converge and become intensely strong. In mid-September, the CDC even set up its activated Operations Emergency Center to investigate this. But the story picked up very rapidly around the world. In Australia, Australia's own Greg Hunt, it said in September, the government's position on e-cigarettes remained unchanged, and the minister is firmly opposed to changing the current laws, particularly in light of recent statements made by the FDA about an epidemic of addiction among teen users. Simon Chapman, the great anti-vaping campaigner in Australia, said the EVALI cases were the canary in the coal mine of vaping. India in September banned all tobacco harm reduction products, citing risks to youth. The only organization that tried to counter this was Public Health England, which has been very positive about e-cigarettes, saying we need to be clear about what this outbreak is and is not. It is not a problem linked to long-term use of regulated nicotine vaping products. If it were, we would expect a very different demographic affected, more typical of long-term vapers. And it took months for the CDC to finally recognize in November that a product called vitamin E acetate, which is the main cutting agent that is used in these illegal cannabis products, that was causing the lung injuries. And only in January did the CDC remove its guidance advising that all vapers stop vaping. But by this point, even though the story was very clear that vaping nicotine products was not causing these problems, the damage had really already been done. A Morning Consult poll in February showed that just 28% of adults believe tainted THC products were responsible for vaping-related injuries. And even in the UK, which has been very positive towards vaping, the public perception of e-cigarettes and their harms was massively altered. The proportion of people perceiving e-cigs as less harmful than cigarettes decreased by around a third. So even though the CDC has not entirely retracted or made clear to the public what the problem was here, the damage to people's perceptions of vaping has really already been ingrained. And this isn't just in the UK or the US, it's in Australia, it's across the world. And now we've faced another attempt to try and portray vaping in the worst possible light, which is to try and associate it with COVID, which is absolutely extraordinary, as there is no evidence anywhere else in the world suggesting that vaping in any way makes you more susceptible to COVID or is likely to give you worse outcomes. But New York City Mayor Bill de Blasio has commented on this, advising people to give up vaping because of COVID. The Campaign for Tobacco-Free Kids and many other organizations are peddling also the same narrative. The Surgeon General of the US also suggested that at a time when it looked like more young people in New York were getting COVID and seemed to be suffering from COVID, said the reason could be for vaping without any evidence. And the FDA, Bloomberg News even ran a headline with saying that vaping could compound health risks tied to the virus. That was actually pedaled back by the FDA after some pressure from public health experts. So I'd say the situation we are in now is very much influenced across the world by what is happening in the US, which is a twin problem of an alleged youth epidemic, and I hope we'd start ditching the word epidemic in relation to kids occasionally experimenting with vaping, and now we know what a real epidemic is, as in an actual contagious disease that can cause severe harm. But I think there is a huge problem for those advocating vaping and tobacco harm reduction in that the perception and image around vaping has been immensely tarnished over the last 12 months. I don't think to an irreparable degree. I think counter-narratives can be put forward, especially as current public health professionals across the world have shown themselves not to be the experts on everything and have made major mistakes in regard to either handling COVID and many other public health policies. So I think the situation for vaping and tobacco harm reduction is incredibly bad at the moment. The public needs an incredible amount of education to correct some of the myths and narratives around what's been happening. But it has been, unfortunately, to be the doomsayer here, it has been a very bad year for tobacco harm reduction and those looking to switch over from smoking to safer products. So I'll end with that gloomy note of just setting out the situation for the last year or so, but hopefully we'll have better news and better suggestions when we get to Q&A and the rest of the speakers.
Absolutely. Thank you, Guy. Thank you for that talk and for sort of expanding on basically the sort of big lie that was the E-Valley epidemic. It was something that really put us here in Australia on the back foot for a good 6 to 8 months, just trying to cut through the actual narrative. And unfortunately in Australia, once all the information came out that said that we were correct and that this wasn't this great vaping death epidemic, unfortunately, the Australian media didn't then correct the record, whereas at least in America there seems to have been an attempt to do that. We'll go to our next speaker, which will be just one moment. We're just going to go across to Michelle, who is going to talk through sort of the advocacy work that she's done on vaping, as well as all the work that goes towards the vaping campaign in America.
And we'll get to all your questions at the end.
Yes, we're getting heaps of questions coming through, actually.
So good.
Well, first of all, thank you so much for inviting me. It's great to be on a panel with people I consider to be allies and friends, and going after Guy is actually perfect because I'm the immovable optimist, I think, of anybody I know, the most immovable optimist. And I think this year, as bad as it has been, has actually had a lot of positives. And obviously this depends on what country and where the activism, where the politics are at the moment. But I think what we've had, well, first of all, I guess I should tell you a little bit about me. If you're not aware, I work for the Competitive Enterprise Institute, as I have for 13 years. We're a nonpartisan think tank in DC. And what I do there is I write about consumer policy, mostly from the consumer's perspective. So giving people the right to make their own choices, particularly about the risks that they want to take, whether it's alcohol, gambling, cannabis, or vaping. And vaping has become one of my primary issues because for me, it is so clear cut. And it isn't just about, I mean, it is about enjoyment. People vape because they like it. And that's a lot of for most people, that's why they transition from smoking to vaping. But it's also this immense public health miracle almost. I don't like to use the word miracle, but it could be this monumental shift in global health that we are potentially squandering. And that's why I've dedicated most of my energy over the last 7 years or so to this one issue. And what I wanted to talk about a little bit is, you know, what we've done activism-wise in the US, what other countries should be thinking about, and what activists can start doing right now to combat what's, you know, happening. If there's any canary in the coal mine when it comes to bad politics, the US is definitely it with public health in most things. Bad public health politics spread throughout the globe like a pandemic. But so, as I was saying, it's been a bad year in a lot of ways, but also a very good year for what I think we need to do in the activism world. And there are a few small rules that I would suggest to other activists who are thinking about getting into this, who are just starting, or trying to drum up interest among vapers in their country. The first one being, get a billionaire on your side. Easy, right? And if you can't do that, the real number one is get allies. You need, if you don't have a Mike Bloomberg with billions of dollars just showering different organizations and hundreds of millions of dollars, which that would be lovely. If you don't have that, what you need is a really strong, active, committed group of people around the world. And there is no shortage of that. There are no shortage of scientists, of activists, of people like Greg and Paul, who are just ace political guys, people who are legal scholars. They're all over the world and willing to help. You know, when I saw what was happening in Australia, I'd visited Australia recently and realized my complete ignorance of Australian politics, but I wanted to get involved in some way. I wanted to do something to help the people that I knew who were living in Australia, who were potentially about to be cut off from a life-saving technology. So I reached out to Brian and other people in Australia and said, what can I do? Can I write something? Whatever it is, let me know. So they're out there. You can find them, and you need to be working together, working on talking points, and educating. And the second rule that I would say is to be proactive. Vaping had a great story. When it first landed, most people believed that it was a safer alternative, and it stayed that way for a couple of years until the anti-tobacco movement really started to mobilize and spin the narrative that it was just another big tobacco product trying to, brainwash our children and get them addicted to e-cigarettes and move straight to cigarettes, which that particular narrative that e-cigarettes move children to smoking has kind of been dropped a little bit, where it's just the use of e-cigarettes is the worst thing that could ever happen to them. So then you had that, and the activism movement, it was there in the US, but it hadn't really been proactive. And so when anti-tobacco groups were using this narrative that they had built up in the public's mind for many, many decades, they just copy and pasted it onto e-cigarettes, and the public, the media, lawmakers, it was such a compelling narrative, this good, bad dichotomy, I guess, that it just took over really quickly. And then we were kind of left scrambling, and in a way that scramble is what mobilized movement. I know we're seeing that in Australia now, when you had this big threat, people are suddenly realizing that this could really be taken away, and it activates people. And wherever you are in your country, even in the United States, wherever you are from that moment, you need to start being proactive and think in the long term. I was watching an interview with Alex Clark of CASA, which is a vapor rights, a non-combustible tobacco consumer group in the United States, and he was talking about people who often lament that we're having the same, in the United States, we keep having the same fights over and over and over again in every single state, at the federal level, flavors, nicotine caps, whatever it is, advertising, kids, and people are lamenting that they have to keep having the same fight over again. And something Alex said really resonated with me, which is, it would be worse if we weren't having that fight anymore, because it would mean that we've lost. And I think that's really true, that the way freedom works, it's not something you're just given and you just have it forever. It's good, you're done. It's something you have to fight for every single day, because the people who would take it away from you if they could grow like weeds. And if you just let them continue to grow, you're going to have a really big problem. You need to start pulling those weeds every single day. And that doesn't necessarily mean dedicating your life to it, having a job in it, but it does mean staying aware, staying active, educating people within your sphere of, whatever your sphere of influence is, working on that. And that's, I think, the biggest thing that all of us, wherever we are in the world, really need to be focusing on right now. We need to focus on the story that we're telling, because we also have a very, when I say we, I just mean anybody who cares about people not dying from smoking, which should be everybody. That group of people, we have an extremely compelling story that needs to be told. And most people are not stupid. Throwing facts and statistics at them doesn't work, but if you explain to them, most people just, if you look at in the United States, it's liberals, Democrats, progressive, that side, where someone said it's e-cigarettes, snus, this sort of thing, it's just a big tobacco ploy. And there are people that they trust in their group, friends and people they respect, who are saying this, and so they go along with it. What we need to start doing is instilling some skepticism about that. And I think one of the good things that has happened over this year with the outbreak of illicit THC lung injuries, not that that was good in any way, but the one thing that it did show, as the outbreak of COVID has shown, is that our public health experts aren't always right, and their prescriptions are not always the right way to do things. And particularly with CDC, Centers for Disease Control in the United States, dragging its feet for almost half a year on an outbreak of lung injuries that was happening while you had people saying, the numbers are very clear. You never get to 100% certainty when there's a toxin or an outbreak like this with foodborne illness, for example. You very rarely even get to 70 or 80% of people saying, yes, I ate that lettuce, that's why I got sick. But we were in the 90% of people admitting, in states where cannabis is still illegal and people who are underage, admitting that they used cannabis products. It was very clear that it was highly likely that almost all of the cases, if not all of the cases, were due to that. And the CDC was not putting that front and center as they should be, so that to this very day, most people don't know that. But that's a very good thing to take to somebody who's not aware of these issues, someone who doesn't smoke, doesn't know anybody who vapes. Maybe they're just going along with their particular political group, what they think is what the media is saying. You could say, well, here's where they were wrong on this one thing. And I think that one of the reasons the CDC was potentially willfully misleading people was because of its bias against e-cigarettes. They wanted to sell their particular narrative. And when you instill that skepticism, not necessarily saying you're wrong, there's certain people whose minds you will never make up, or you will never change their minds. But for the people whose minds aren't made up, you can talk to them, ask them what their concerns are, and say, maybe you want to do some more research on that. And this is lawmakers, people who are just friends, especially local lawmakers, because they're the ones who will actually talk to you. Getting a sit down with a United States congressperson or a senator is extremely difficult. The best you're going to get, if you're lucky, are staff. But if you talk to your local lawmakers and keep talking to them, you can actually get a sit down. You can talk to them on social media or through email sometimes. And that's where you really want to start and work your way up. You also want to talk to media whenever you can, telling your story. One of the things I would say is, like I said, we have a good narrative to tell. You don't want to be too emotional. The other side has that handled. They're all about emotion, and that can be compelling. But on our side, we want to, we're talking about life and death. If you're in this, you may know lots of people, or at least a few people, who will swear that by switching from smoking to e-cigarettes, their health is improved. At the very least, their health is improved, and they are certain for the most part that they have saved their lives, that they're not going to die from a smoking related disease because of this decision that they made for themselves. And I think in the United States anyway, that should be a very compelling story, this idea that a single individual assessed the risk for themselves, decided to do something for their health that cost our government absolutely nothing. That is public health, unicorn. Something like that, where people can improve their health. It doesn't cost the government anything. They're not even calling quit lines that the government might pay for. And the very last piece of advice that I would give to activists in this space is that you shouldn't be dogmatic. I mean, we all very strongly believe what we believe about non-combustible forms of tobacco because most of us have done a lot of reading, a lot of research. If you're using them yourself, you've felt the difference. But one should always be open at least to, the other side, again, they've got dogmatism covered. And when it comes to rhetoric, when it comes to persuasion, it's actually not very convincing. Shouting people down is not convincing. It might seem like it is because nobody's saying anything in response, but that's because they don't invite anybody to their groups or their webinars who might have any kind of disagreement. So it seems like everyone is just agreeing, but shouting people down and dogmatism doesn't usually work. You can see it sometimes when there's a panel, for example, in the US in Congress, you have the anti-tobacco people and then one person who's not anti-tobacco, not necessarily pro-vaping, but just not anti-tobacco. And they will hedge their language. It will say, well, this is what we know. There may be some risks to vaping, nicotine products, for example, but we know that they're much, much safer. And on the other side, it's bedlam. It's children are going to die. Smoking rates are going to rise to 99% of the population. And that's ridiculous. And everybody knows it's ridiculous. So I think from our side, we need to start educating people, telling our very compelling story, and to start instilling doubt in the people who are at the lower levels who, you know, they've never researched this at all, but they are certain, you know, a lot of them in the United States anyway are mothers. They're very certain that e-cigarettes are attracting their kids, and the e-cigarette companies are whispering in their ears, trying to get them addicted to nicotine. Those are the people where you can start to maybe talk to them and say, here are some times when public health wasn't correct, and here's some other countries that are doing it and they're having some pretty good experiences. Maybe you want to think about that a little. So, I mean, those are the tips I have. Happy to answer questions about anything on the topic, and thanks for letting me talk.
Okay, thank you, Michelle. Really appreciate that. I think on one of the key points that you were raising, which is, you know, people sort of getting involved at all levels. You know, a lot of vapers are from working class backgrounds, and the feedback we get in Australia is they go, well, you know, I'm working a full-time job. I'm a bit at a loss as to how I can help. There are numerous ways you can help. It can be writing to your local MP, it can be calling a politician, even just educating the general public, because we've all met that person that thinks that, you know, vaping is, you know, going to turn your child into a smoker, which all the evidence shows that's not the case. Just talking to them at a personal level, and as Michelle said, you know, not berating them, and just educating them about how it's benefited you, and getting out there. There's numerous ways you can get involved.
Yeah. I'd like to point out Andrew's comment about reaching out to his local member who refused to meet with him. Just keep working, keep trying, keep sending those emails and those letters. Australians are very lucky because our federal members are much more accessible than Congress. So for Americans, yes, definitely reach out to your state representative. They will talk to you. But Australians are very lucky because they can talk to their federal members in a way that Americans can't. And keep pushing. Your letters, they're seen by staff at the very least.
Yes. And, you know, at a separate level, if maybe your local MP won't meet with you, you can always contact your senators. A lot of senators are acutely aware of the vaping issue in Australia. So make sure you melt those phone lines, as we like to say in some of our emails.
Yes.
We're going to go across to our next speaker. Paul Blair is from Americans for Tax Reform and has been an integral figure in the fight for vapers' rights in America. Paul, we're going to cut across to you.
Well, thanks for having me. You know, looking back to the last time that I spoke to this conference, it was 2017. And so that was 3 years ago now, when, you know, the subject was the same that I was talking about, which was coalitions, you know, how this issue had begun to develop as a political issue in the United States. You know, obviously some of the issues that still exist in Australia and certainly many countries around the world are still kind of similar. We've gone through ups and downs of new threats and opportunities over the last 3 years, but a lot remains unchanged in terms of our adversaries, our opponents, and what we're up against. You know, I'll talk a little bit about how Americans for Tax Reform got involved, in case there are folks who don't have a lot of familiarity with us. I know that the president of our organization, Governor Norquist, I think is speaking tomorrow about liberty and coalitions in general. So if you're tuned in, some of this may, I guarantee he'll mention vaping because he always does to everyone he talks to, probably because I remind him about it so much. But, you know, when it comes to taxes, across the world on social services, there is a disproportionate impact on social health and public health expenditures as it relates to the healthcare costs borne by taxpayers as a result of tobacco use. Now, if you're a progressive or a member of the political left, you may think what that means is we should discourage smoking and ban smoking and tax it to oblivion, and do everything as possible to make it as regressive and, you know, as punished activity as possible. If you're sensible and understand how markets work and understand how consumers respond to those sort of policies, you'd embrace free markets and innovation as a potential to solve problems that you view as ones that government should look at. And so when it comes to taxes, in the United States, and I think there are a lot of countries around the world where it's the same, the government in total makes more than the combined total for manufacturers, wholesalers, distributors, and retailers of all cigarettes. So for every cigarette sold in the United States, the government makes more money than the actual businesses that produce and sell these products. That's important because when it comes to the regulation, taxation, embrace or lack thereof of alternatives, there are significant long-term implications to getting the regulation of reduced risk products and tobacco harm reduction wrong, not only from a moral perspective, not only from a life-saving perspective, but also as it relates to what we spend money on and what we can necessarily save a lot of money on. And you know, so that's sort of how ATR began to look at this issue back in 2013 and 2014, when we had states that began to look at vaping and said, these products, they look like cigarettes. And at the time they did. A lot of the original ones that were not like homemade, the ones, you know, like the Enjoys of the world, they kind of looked like cigarettes, until public health said that that's going to renormalize smoking. And so we can't have them look like cigarettes anymore. They've got to look like, you know, R2D2 devices. And so, you know, we had between 2014 and 2017, more than 35 states look at taxing these products the same way that they tax cigarettes. And what that did for a lot of consumers in the US that went from 1 million to 2 million to 5 million to 10 million between 2012 and 2015 was infuriate a lot of people, and for good reason, because as any vapor on that's listening to this or watching this may know, the reason largely that you transition from a cigarette to an e-cigarette is for the potential health benefit. But certainly there are advantages in terms of cost savings as well when you go from an extremely taxed product to a less taxed product. And so that presented real issues in terms of the potential benefit for risk reduction among adults who you want to transition to these products. But what it also did, other than exposing public health as a giant fraud, and the reason I say that is because what they argued for years, really from the early 90s until today, and they'll always do it, is that the reason we had to have extremely high taxes on tobacco products, and in particular cigarettes, is because of those costs on taxpayers that comes across in the form of public expenditures we make on health. And they said it was about health. They said that those taxes were about health. Well, when in 2014 it became clear that taxing the alternative products was their next new top objective, it exposed that public health really was a fraud when it comes to the entire embrace or regulation or approach to risk reduction. Fortunately, what we've seen in the last year or so is that argument has disappeared. They've obviously come up with new and creative ones, like this is the new way to addict children to nicotine, or kill you from COVID, or whatever the new fake crisis is of the day. But I think what it's really done is radicalized a new constituency of people to really question science. For a conservative libertarian, I think that's fantastic. But for public health, it should be concerning, because at some point we do need institutions and credible institutions to make recommendations on what to do in like real pandemics. The debate around masks, the debate around whether people get a COVID-19 vaccine. You don't want millions of people to look at the CDC or the World Health Organization and all the recommendations they might make, which are valid and which are true, and to say, screw you. Everything that you make recommendations about as it relates to my personal choice and personal freedom has nothing to do with health, and everything to do with nanny state activism and progressivism as a general political agenda. And so there are real concerns here that aren't only about the personal freedom of consumers who are trying to save their own lives, but about public health in general as an entity and institution that we do need to exist. In the US last year, this really all came to a head. On September 11th, and I won't get too much into it because I'll defer to Greg a little bit, and maybe we'll talk about it in the Q&A. But I know this fight was heard around the world. We had the President of the United States at an impromptu press conference in the Oval Office declare that he was going to ban essentially every e-cigarette and vapor product on the market. And fortunately, there were a significant number of consumers and small businesses that said, "Are you serious? We can't let this happen." And weighed in with the White House. They made phone calls. They sent emails. They got very active on Twitter. They made 15, 30-second video testimonials, all great approaches to engaging with members of Congress, regulators, lawmakers, and certainly with the president in the US when we engaged in this. And in a matter of 2 days, certainly there was a lot that occurred within those 48 hours. Greg was on TV, I was on TV, lots of people were on Twitter. Reporters ate this up because the narrative that we had put out there was there are 13 million of these adults in the US. Many of them vote. And by the way, we have polling that suggests that this is their most important issue. But in 2 days, we went from, we're banning all these products, to the President of the United States tweeting, "I like vaping," all caps, as an alternative to smoking, all caps, for adults. And it was the first embrace of tobacco harm reduction that a president of the United States had ever engaged in. Certainly we didn't see under the Obama administration. Certainly no previous president had made such a declarative, strong statement about tobacco harm reduction. But the fight isn't over yet. I mean, it took 4 more months for us to really get to the result that we did, which wasn't an ultimate victory, but certainly was a compromise that stopped short of a return to the 1920s. And prohibition, the very successful test case that was. But obviously there are, I think, a lot of lessons to be learned that Australians can take into consideration for how that fight occurred in the US and certainly around the world, which is, and this goes to the statement about, I don't have a lot of time, how do I engage? If money and paid volunteers and orchestrated movements were what ultimately succeeded on so many issues, we would never win. There'd be no such thing as liberty, because Mike Bloomberg spends billions of dollars not only failing to get himself elected president of the United States, but on stupid causes like banning e-cigarettes or guns or anything else in the world, and is very frequently unsuccessful. And I think that's what's important about the personal stories that so many vapors have, that so many small businesses have. There are so many vape shops that the reason that someone opened a vape shop and got into the business is because they probably experimented with e-cigarettes, found that they worked to help them quit smoking, and they wanted to share that experience with so many other people. That story itself is so compelling as a story for politicians, the press, and lawmakers, because this isn't random bodega, gas station, grocery store guy who sells cigarettes and e-cigarettes, which is largely what the tobacco fights end up being, because tobacco retailers, while there are several thousand of them, aren't as politically passionate about the sale of cigarettes as vapors are, for good reason, because there aren't like net public health benefits involved in the sale of most tobacco products, unless you're quitting smoking with something like smokeless tobacco or e-cigarettes. And so I think that the genuine stories of consumers and businesses that came to light for the first time nationally in the US between September and January are one of the main reasons that Michelle might have optimism, because we really were able to fight back against the BS narrative of the Bloomberg-funded organizations and even the CDC and FDA, which had to reverse course on a number of issues and a number of claims that they made between September and January, when the CDC ultimately finally recognized and edited their stupid website to suggest that it was THC that was getting most people sick. Even though all of the data from day one really showed that, whether it was 75% of the people that admitted that the reason they were getting sick was that they had, bummed some THC products from their friends, or 99%, which is really where it ended up at the end of the day. And so, in the U.S., this was a fight that, because of tax fights and regulatory fights at the state and local level over many, many years, I think had radicalized a lot of people. But I think that what consumers and businesses around the world need to understand, as fights seem to be lost or opportunities are on the horizon, is that those testimonials, and the passion of individuals and consumers is so important, because a reporter and a politician cannot write off those stories as simply ones that come from people who are making millions of dollars selling products. It's simply not true. The diversity of the industry, from vape shops to e-liquid manufacturers and wholesalers and distributors, cannot be written off as one or two companies making a lot of money selling these products, because it's just not the virtue of the industry at this time. Now, forced into a regulatory regime, that is often what happens. You only have 4 or 5 large, big guys at the end of the day that survive, and that's kind of what we have in the tobacco world. And somewhat might be the direction we head in the vaping world in the US, as a result of sort of the regulatory regime that businesses here have been facing. But I would not sell short, or discount the opportunity for businesses to simply share their stories, and consumers have to be encouraged by businesses to do that as well. Give discounts to consumers that share their stories and write their testimonials down and put them in the mail and send them to your local elected official. That's, I think, been a compelling opportunity for engagement, both with businesses and consumers, that we've seen in the US as well. And so with that, I'll end my remarks, because I know we want to make sure we hear from Greg and do Q&A, but certainly appreciate the opportunity.
Absolutely. Thanks, Paul. Look, in the interest of time and to make sure we get to questions, because we get hammered with questions, we're going to go straight across to Greg. Greg heads up the American Vaping Association. Greg, thank you so much for joining this discussion, and we'll throw over to you.
Thanks for having me. And in the interest of getting to all those questions that I've seen popping up in the chat, I'll try to be brief. Can you hear me?
Yes.
Okay, perfect. So I have been doing this work now for approximately 10 years. Next August 10th or 11th of 2020, will be 10 years since I quit with vaping. And then almost immediately upon successfully quitting, saw that there were state legislatures that were actually considering following the FDA's lead at the time and declaring e-cigarettes to be illegal, unregulated drugs that could not be sold. And like many of you listening to this, you quit smoking with vaping, and one of your first thoughts is, man, once people learn about these, once people understand the positive health impacts, man, public health is going to be right with us. Tobacco control is going to see the light, and they'll be here to say, this is how we eliminate smoking. Unfortunately, that is not what occurred in America, and America has great influence all around the world. And Paul referred to it earlier, but I think of it as the longest week of my life last September, where in the span of around 36 hours, we had Michael Bloomberg announcing that he was going to be putting $160 million over the next 3 years towards banning the sale of flavored vaping products, with I'm sure most of that money to be spent in America. Then you had the governor of Michigan, a Democrat, announced that to protect the children in the midst of all of the lung disease and illnesses, she was going to ban all flavored vaping products just through executive action with no input from the state legislature. And then, as I was recovering from a very long night of dealing with what happened in Michigan, I get the news, hey, did you see what Trump did in the Oval Office? And that was when Secretary Azar, our Health and Human Services Secretary, came to Trump, and Trump probably had thought about e-cigarettes for approximately 8 seconds of his life before that day. And Secretary Azar said, these flavors, they're hooking kids, and now people are dying. So naturally, Trump, not the kind of guy that sits down with a giant briefing book and decides what to do. He moves on emotion. He went and said, vaping is hurting people. We need to do something about it. And as Paul detailed, vapors instinctively acted. We didn't have to tell them, hey, go on social media, tag President Trump, tag Brad Parscale, his then campaign manager, and tell them this issue is important for you. So you had vapors who before that day, maybe they were on Facebook, but they didn't do much. And they saw that all the other vapors were saying, I'm joining Twitter and I'm sending a message right now. That got heard. That plus the many civil libertarians and just plain old GOP members on Twitter saying, what is going on? Why is this being done? It seems to be that it's not these nicotine vaping products that are actually killing people. And I spent that week getting yelled at on TV like Paul. I had Dr. Sanjay Gupta and Chris Cuomo both essentially call me a child killer. A nice way to spend a Friday evening. But in the end, we turned out to be right. The bad news, as Guy went into, is that this has infected the minds of people all across the globe. You now have large swaths of populations, even outside of America, that believe that nicotine vaping not only is just as bad as smoking, but unlike smoking, it could send people to the hospital in just days or weeks. And beating back that narrative is extremely difficult. One positive, if you look at the glass as half full rather than the glass is half empty, where consumer choice in America, due to inappropriate FDA regs, is going to be extremely limited. One good thing for the future of the international countries is that you are going to have the US FDA reviewing these products. And when they approve or deny a product, the approval is based off, is this product appropriate for the protection of public health? And then just like we had with IQOS recently, you're going to have the FDA deciding whether or not to allow a product to say this presents reduced risk, which FDA said no to IQOS about, we disagree though, or reduced exposure to toxic and harmful chemicals. So at some point, you are going to have the FDA say definitively, vaping products, these vaping products are safer than smoking, much safer. If smokers switch, good for their health. It's going to be more difficult when you are able to actually reference, this is what the FDA has said, why can't we do something similar, hopefully not as terrible and awful as our US FDA? Lessons to be learned there. But it's been a long 10 years. Thankfully, just this week, I will not be able to have a big celebration next month like I hoped for my 10-year anniversary, but at least I was able to do this seminar and actually get a haircut this week for the first time in 4 months. I hope things are better in Australia than they are in the US right now. Thank you.
Thank you. It's a great haircut.
Things are better in Australia depending on what state you're in. Thankfully, we're in a state that isn't locked down, which we count our lucky stars for. I'm going to cut straight to questions. We have a question from Rian, which I think is quite a good one, which is for the entire panel. Do vapors undercut the case for vaping by negating the risks associated with it, particularly for non-smokers? So essentially, are there any concessions that vaping advocates can make? And for reference, here with Legalise Vaping Australia, we always, when asked about it, say, look, if you don't smoke, you shouldn't be vaping. But I guess, we always extol the virtues of vaping being a harm reduction tool. And one of the straw man arguments that are built up by anti-vapers is that we're trying to encourage everyone to vape, which I'll throw to the floor on that to sort of expand on a bit.
Well, if we can speak to that question, be very brief. If there was evidence that that was true, I totally would concede it. There's trade-offs to everything. Nothing is 100% good. Nothing is 100% bad. There's trade-offs to everything. And for instance, in fact, what we see with cigarette smoking, for instance, is that most children follow the behavior of their parents. So if you have a parent who smokes, you're much more likely to smoke. That doesn't appear to be the case with vaping. So for instance, aside from the US, which has had an increase in experimentation of youth vaping, that is not correlated exactly with an increase in adult vaping. These are kids trying to do a rebellious thing at school. Also in the UK, where vaping is actively encouraged by public health authorities, youth vaping is de minimis. It's incredibly low and doesn't really tick up at all. And I think part of that, and I think Michelle can speak better this than I can, is that it's being promoted as a harm reduction tool. It's not a cool thing for kids to do. So even if parents are vaping, their kids don't seem to be vaping. So I think if obviously, youth should not be vaping, and efforts do need to be taken to encourage youth not to vape, but in a realistic and effective fashion. But we don't appear to see the same pattern with vaping that we did with smoking, in which children seem to inherit the preferences and behaviors of their parents in the same way. So thankfully, it doesn't seem that the pattern holds.
And,
And Guy and Phil are both academics and talk with lots of facts and figures. Bottom line, my advice to advocates is don't pretty much disconnect the word safe from your vocabulary. These products are much safer, much less hazardous, at least 95% less hazardous than smoking. And refer, when you're talking about the people that you want to use this product, adult smokers, adult tobacco users, adults. Be specific with your language, even if you feel like you're saying the word too often.
The last point,
oh, go ahead. Sorry, go ahead.
So Michelle's done some great work on like why teens might actually be experimenting with these products, which is that the government tells them that they shouldn't and that they're going to die, which is a great motivator for child misbehavior. But the one point I'll make is what we're also seeing on teen use is that almost all of them, 98% in the US, of teens that are reporting experimenting with e-cigarettes and doing so on a regular, ongoing basis, they're, number one, not transitioning to cigarettes, and most of them are other tobacco product users. It's a very low percentage, even among the regular experimenters of these products, that were never tobacco product users across the board. And so to be somewhat controversial, I would suggest that teens vaping is actually a much better outcome, because we are seeing the greatest year-over-year declines in teen smoking. And so not that we should go out and tell teens to vape, because of course we shouldn't, but we can't discount the fact that they're experimenting with products that are a lot less harmful than ones that they've been experimenting at relatively high rates prior to the existence of e-cigarettes on the market.
Yeah, and I would be even more controversial, and I wouldn't suggest you saying this to people, but when you're talking to lawmakers or people who are skeptical. But well, first of all, nobody negates the fact that there are risks involved with using nicotine. But I would also suggest that there is nothing wrong with a non-smoker who understands the risks, who wants to use nicotine. Just in the same way that when someone turns 21 in the United States, or I think it's 18 in Australia, we don't say, oh no, you shouldn't drink alcohol. That's risky. Right? We all understand that there are risks involved with caffeine, with alcohol, with marijuana in the United States and also some parts of Australia, I think. There are risks, but that's a thing that you make a trade-off on. You say, I enjoy this thing. I want to enjoy this thing. And I mean, not to get into the research, but nobody on the planet pretty much, unless you're in a very remote village somewhere without access to the internet or television, nobody doesn't already know that nicotine is addictive in some way or habit forming, dependence forming. So if you're an adult and you say, I want to try this thing, you already understand that there's a risk that you might become dependent on it and then have to spend a lot of money for however many years you want to keep doing it to continue doing that. But we have found acceptable ways to educate youth and to prevent them in enough of a way from doing other adult behaviors. We should be able to do that with this other adult product.
Absolutely. And thank you for sort of tackling that issue. Michelle, this is a question for you that we'll probably wrap on, which is, you previously mentioned the CDC in your talk. In Australia, our health bodies here reference the World Health Organization stance on e-cigarettes. Have you got anything to say about, when local governments refer to, unelected sort of global bureaucracies of sorts and say, well, we just rely on their studies. I think last we checked, some of their studies are more than half a decade old.
I mean, that's exactly what you can say, is that it's hard to go into the weeds. Rhetorically, it's not necessarily a great strategy to be like, oh, they used this bad study or that bad study. But you could say, historically, the WHO has been wrong in the past. If you just look at snus, for example, WHO, I think, is still pretty anti-snus. All of Europe, except for Sweden, has banned it. And you look at Sweden, and Sweden has by far the lowest lung cancer rates of all of Europe. and they have the lowest smoking rates of all of Europe, not coincidentally, because they also have the highest use of snus. They have pretty much just displaced smoking with snus. And it's places like the World Health Organization still do not endorse a non-combustible product. They are wrong. They are demonstrably wrong. You could maybe point to something like COVID and say they're wrong as well. And even if they're this grand, giant organization, they are not always right. They are not angels. Some of them are funded in particular ways that could be problematic, like Bloomberg, for example, funding WHO, or United States funding WHO, all these interested parties. I mean, you can instill, like I said, skepticism and say, I don't think they're necessarily wrong about everything, but the evidence points to the fact that they are dead wrong on this topic.
Absolutely. And on that, thank you so much for joining this panel. We all really appreciate each and every one of you for making the time to join in and sort of help the Australian vaping community with our fight. Australia sometimes seems to be a bit of an uncrackable safe when it comes to proper regulatory policy, but hopefully we'll get there. To everyone who joined in, thank you so much. Thank you for all the questions. Sorry that we couldn't get to all of them. We were just getting slammed with questions and wanted to pick out some of the core ones that really strike to the issue. A full recording of this interview will be published once the conference is over. And hopefully we'll see you at the next breakout session or on the next live stream that's coming up shortly.
If you want to discuss further, there are social rooms where you can go and discuss this topic with other people that were in this breakout.
Absolutely. Talk soon. Thank you all.
Thank you.